My name is Marjuel VonMoore, and I am presenting the purpose of project management. The purpose of a project manager is to take on the vision or goal of a facility and map out a plan to achieve the goal. This can be attained by soliciting the appropriate team members to break up the task to achieve those goals. When dealing with team members, the project manager needs to make sure that she keeps the team members focused, keep them progressing toward the end of the goal, and keep them positive and motivated. The team members also need to stay within budgetary boundaries, which the manager needs to make sure that she convey to them what it is that's needed for that. My topic of choice is increasing customer satisfaction rates. I've noticed in the month of March that we started to decline in customer satisfaction rates. And in doing so, the scope of the project will include the initial introduction of patient to the unit. This will be done by the cooperation of the unit manager and charge nurses upon admission. They need to go into the patient's room and introduce themselves and find out what it is they need to make their stay more pleasant. This can be as simple as giving them passwords for their electronic and mobile devices, being able to observe their religious times, having interpreters for any language barriers, and special accommodations for their visiting guests. The team nurses and the aides will be properly trained in ADAT, which is acknowledge, introduce, duration, explanation, and thank you. Most times they're just giving a pamphlet with ADAT on there, and no one holds them accountable or responsible in actually carrying that out. So they need to be trained in the proper use of ADAT so that they can use ADAT properly towards the patient. Upon discharge, the nurse who is discharging the patient needs to give concise, clear education about their medications, discharge instructions, other information that the doctor wants to relay, and any follow-up appointments that the patient needs to keep. The last part of this will actually be the survey. The survey will be conducted via phone, fax, email, or even snail mail. This will be a question and answer, questioning the patient about their stay at the facility and how pleasant it was for them. The stakeholders are the hospital investors and all those management positions that indirectly get bonuses or pay increases due to increased satisfaction of the customer. The estimated time frame is a quarter, which is 90 days. I should see 15% increase from the last quarter's drastic drop. The financial considerations are one billable hour per shift, which would be overtime for those people on the team, which comes out to be about 66 hours per quarter times the overtime hours for that particular employee. My references used for this production is McGonigal D. and Garver Maestrian, 2011, Nursing Informatics and the Foundation of Knowledge, 2nd edition, Improving Patient Satisfaction, Success Stories from Two Hospitals, 2014, April 10th, which is a website search, and Train Hospitals in Customer Service to Boost Patient Satisfaction, which is also a website search. Thank you.